Congratulations, you're pregnant. Most of my patients will see me around 5 to 6 weeks of pregnancy, at which point we will do an ultrasound scan to confirm ongoing development of the pregnancy and give you a good estimation of when your little angel is due for delivery. There'll be a comprehensive conversation at that point in time after congratulations to let you know about the various considerations you need to have in terms of diet and exercise, the do's and don'ts of pregnancy. You'll be given a form for a whole raft of blood tests, from an anemia screen, a hormone profile, an infection screen, and the like. And importantly, your obstetrician will have a conversation with you about screening for Down syndrome and other genetic abnormalities. Now, the gold standard in this regard these days has become the NIPT, non-invasive prenatal testing. It's a blood test which I typically recommend at around about 11 weeks of gestation that will actually sample some baby's DNA that is circulating in your bloodstream. That gives us fabulous information about Down syndrome, a couple of other genetic abnormalities, and excitingly can even tell you the sex of your baby. Let's talk about how you might be feeling at this stage of pregnancy. Nausea can be a big problem, and for some women, vomiting and an inability to keep down their food and drink can be an issue. Thankfully, your obstetrician or your general practitioner have got plenty of advice they can give you in terms of therapies to help. That ranges from simple things such as ginger and vitamin B through to a variety of medications safe in pregnancy that are proven and well established to help settle down the nausea and vomiting associated with the first trimester of pregnancy. The other thing, as we mentioned, is the often quite significant fatigue that women feel in the first trimester. This can be quite surprising, and it really reflects the huge physiological demand that your body's going through at that stage in developing that early pregnancy. It will usually improve, along with your nausea and vomiting, towards the 12th or 13th week of pregnancy. It's followed up by an ultrasound scan, typically around 13 weeks, which is critically important. That ultrasound scan will astonish you in terms of the information, the clarity that can be achieved at that early stage, and also gives us a good structural overview of the baby's development, and additionally, with the input of your obstetrician, can give you a risk profile for your chances of developing problems later in pregnancy that we can then seek to address before they become an issue.